Here at the Eye Center of Orange County, we've been serving the Laguna Woods community for over 30 years. And since we're right down the street, we see many Laguna Woods patients each day. Dr. Purnazar and Dr. Ng treat dry eyes, glaucoma, cataracts, and more to help you see better than ever before. So if you're having a little harder time seeing these days, give us a call and see what the Eye Center of Orange County can do for you. Call 949-951-1457 for your exam today.
And we're back with more of what's going on, and of course we all want to keep everybody out there healthy and well and able to enjoy all the good things to do here in Laguna Woods Village. And one of those things, of course, is keeping our vision sharp and keeping our eyes very, very healthy. Joining us today, someone who's been doing that for a number of years here in our community. Dr. Ng is with us today from Eye Center of Orange County, and we welcome you to the show. Good to have you with us today.
Thank you.
A little bit about your practice. You folks have been here for some time.
Yes. We started our practice in Laguna Hills in 1978 when the old Saddleback Memorial Hospital was there, and our offices were actually where the parking lot is now.
Oh yeah.
They raised that building and
the old
put a parking
clinic.
lot. Yes.
Right.
And we moved over to Magdalene office, and we've been in the current office now since 1990.
Mm-hmm. A lot of folks think they know what you do, but ophthalmology is certainly a science that has grown over the years, new techniques, new technologies, but you still provide the basics, eye exams and eye care as well.
We do everything in our office. We do eye exams, as you say. We do cataract surgeries. We have an excellent cataract surgeon. We do LASIK procedures. Dr. Purnazar is a great, great LASIK surgeon. And we treat glaucoma, dry eyes, and all kinds of eye diseases. Actually, we are pretty much all-encompassing as far as the eyes are concerned.
Right. A lot of emphasis today on cosmetics as well for the eyes and eyelids and all those kinds of things. Are you doing some of those things as well?
Oh yeah, we do Botox injections.
Really?
Yes, and Restylane, which is a filler. It's not a paralysis type of medication like Botox is. We have a surgeon in the house called Dr. Schwarzbein, and she does blephs, upper blephs in-house, and her results are just great.
I know a lot of people have felt that's a really good procedure and helps them feel a little bit better about themselves, and also can improve your vision, I believe, if you have really major eyelid issues.
Yes, it lets more light in.
Right.
I mean, you know, you have a lot of people with droopy eyelids or their eyebrows coming down and they're losing their peripheral vision, and you get that out of the way, they just see so much better and so much brighter.
Right. You know, that's one thing I think that's so important to most of us is our vision, obviously being able to still drive and enjoy sports and activities, time with our family and friends, and obviously good eye care is important. Do you find that there are certain conditions, obviously we think of things like cataracts and glaucoma, are age-related. How often do you think people in our age group here, 55 plus, should get in for an eye exam?
I think everybody should have their eyes examined at least annually. Glaucoma creeps up on you. Glaucoma is not necessarily age-related. It is actually inherited. If your mother, father, grandmother, cousin, any relative that has glaucoma, you're a shoo-in for getting glaucoma. So we found lately that there's about 3 or 4 genes involved for the inheritance of glaucoma. So get it checked. If you have any family members with glaucoma, go ahead and get your eyes checked for that. Cataracts are age-related, and the vision is very, very slowly degrading. So you don't really notice it in the very beginning, but as the cataract progresses, the vision gets worse. So yearly exams are really your best bet.
And I know we've heard so much about cataracts. The treatment is so much better than it used to be, and the procedures are so much better, and you even have, I guess, the focusable lenses now, which are an option for people that want to maybe spend a little more, but have a little bit of an improved vision as well.
You really have a lot of cool options now for cataract surgery. You have the Restore lens, the Crystal lens, the Resume. All the lenses nowadays are probably in the 4th or 5th generation, so they're much better than when we first implanted them back in the early 2000s. And the results are so great. I have patients that see far, see near without glasses, and really have no problems at all. It's really exciting. I had cataract surgery about 5 years ago and was really not presented with all the options we have now.
Yeah, a lot of good things going on out there. You mentioned dry eyes. A lot of people just, will go to the pharmacy and buy something off the shelf and several times a day drop a couple drops in their eye. At what point does that become something that the doctor should know about dry eye? How bad does it get before it becomes really a medical problem?
Dry eye is a real nuisance, basically. As a person gets older, their eyes do get drier. And with that, I think a doctor should really monitor it. We do have medications that will help produce better tears and more tears, work on the lacrimal gland. We have artificial tears that are prescription eye drops. We have over-the-counter ones, of course, that people do try. A lot of people do try the eye drops that get the red out, which is not a good option because if they overuse that drop, they tend to either dilate their eyes or get a rebound red reaction. So not a good idea. It's best to consult the doctor.
We're in the late winter, early summer, early springtime of the year, but soon will be upon us, will be summer. And I know a lot of people think about sunglasses and sun damage. When purchasing sunglasses, and I know I have friends that break them every year, so they have to buy a new pair every year, whether we're buying a pair for the first time or new ones, some things to look at in sunglasses? Yes.
FDA, as of a few years ago, has recommended or suggested strongly that all sunglasses sold over the counter now is UVA and UVB sun protected. So no matter where you buy your sunglasses at any retail store, you have protection against the ultraviolet. If you buy it at the swap meets, I can't promise you that. But pretty much the FDA has regulated the sale of sunglasses.
Right. So be real careful about the vendor down there walking along the beach with the sunglasses in his pocket. might not be medically what you want. And a lot of people obviously think cosmetically. And it sounds like from what you're saying that spending a lot of money isn't necessary, that even ones you might buy at the drugstore or someplace, a retail sales place, would be the quality you would need. You're paying extra for fashion or maybe a name brand.
Well, name brands are very important when it comes to us women. So we like to look nice, but also in our age group, a lot of us need corrections for distance, for driving, for just for seeing well.
Right.
And you want to make sure that if you do get sunglasses, you should get it at the doctor's office if you do need a correction.
Okay.
Especially if you're restricted on your driver's license.
You can, if someone does need to wear glasses, you can put a correction in sunglasses or tint a regular lens, I guess, either way.
Yes, if you get sunglasses over the counter, though, we can't promise you that we can use that frame. But if you get a good ophthalmic frame that will withstand putting lenses in there, a prescription lens, yes, we can.
Right. So somebody might have the frame they like and just need the correction and the sun protection, and
we can
do that. Help them with
that
as well. So you have really a full practice, so you can make up the glasses as well as prescribe them.
We are a one-stop shop.
One-stop shop. That's great. Where are you located?
We're located right down the hill from Laguna Woods Village. We are on off of Paseo de Valencia and La Plata, and we've been there, like I said, since 1980. So it's pretty easy to find us.
Good. About a year or so ago, you were purchased by, as we see the new name there, TLC. And they're the ones that really are the owners of the facility over there.
They are.
But you still doing the same work and the same practice and the same folks doing the good eye care.
Yeah, most of our staff has been there for 8 to 10 to 15 years. We're just trying to undergo a new name change to get up to date with the rest of the group. So Eye Center of Orange County will eventually be TLC Laguna Hills. And hopefully we can retain our same patient population.
Good. And you're open to new ones as well?
We're open, pardon?
To new patients as well.
Oh yes, we'd love to see new patients.
Very good. Well, whether it's just for an annual checkup or if you are having some problems with your eyes, you can go talk to them and find out about all the good services they make available over there. Dr. Ring, thank you for joining us on the show today.
You're welcome.
I think I need to go look for some new sunglasses. We'll be coming right back with more right after this.
I'm done. Here at the Eye Center of Orange County, we've treated all your eye care needs for over 30 years.
We treat dry eyes and glaucoma, and we specialize in cataract and refractive surgery. Our goal is to get you seeing better without glasses. If your vision's getting a little blurry, you need to come see me, like Art did.
Now I can see better than ever without glasses.
We're located just down the street from Laguna Woods Village. Call 949-951-1457 for your appointment today.